Hey guys, welcome back to Stove by Paula. I know it has been a minute. A minute is an understatement, but I just really want to say I'm sorry, guys. Um, Life's been hectic, and I know what you're thinking. You're thinking, oh, she's putting up a video because she's in quarantine and Corona's going on, obviously. And although that's partly true, that's not really the reason. I've been actually quite reluctant to put up a Corona video just because I wanted to put up one when the whole situation has passed and give my kind of 2 cents because I realized that a lot of things are being taken out of context. And so one of the things that I just wanted to leave it up to was I wanted to leave it up to the people that could speak best on the matter. But I've recently been seeing bloggers that I follow that are in specific specialties that are not necessarily primary care. So that's like family medicine and internal medicine when I say primary care, have been coming out and really just speaking on Corona. And I see a lot of them are kind of reluctant to speak on the matter, but are sharing their opinions and their thoughts. And these are people that are like surgeons, radiologists. So I think it is important for us as health professionals and future health professionals, because I am a med student, and so I think it's important for us to discuss this because there is a lot of things circulating, and a lot of information out there that's not necessarily correct. And as people who are knowledgeable in health, I think it's important for us to also have um, a say in this whole situation, and just also give our 2 cents so that we're not allowing you know fear also to overrun people when we know we're in a position to help kind of alleviate that. Okay, so just to give you guys a bit of background, I am a final year medical student. I am graduating in 2 months, hopefully. That remains to be seen. And yeah, I'm not a pulmonologist, so that's a lung respiratory doctor. I am not an infectious disease specialist. I am somewhat of an epidemiologist. So, yeah, in that sense, I have a master's degree in global health. So, this is my level of knowledge and expertise that I'm speaking to. So, I just wanted to kind of clarify that before I continue on with this video. I think I have to lean in because the sound is kind of bad, but I just wanted to give you guys a little bit of a background for me. When I say background, I mean like when everything kind of started, because I have been off social media. I actually went off social media for Lent, and ironically, it was also right at the time that everything was just starting to get hectic with Corona. So I have not been on social media, and that's also kind of the reason why I've been keeping quiet about the whole matter. But I'm just going to rewind to the first time I heard about Corona. It was when I was back home. I did an away rotation back home in my home country, Namibia. And I remember my brother and my friend Kenna also asking about Corona. And as a med student, I'm thinking, oh, coronavirus, the two coronaviruses that I could think of, or three rather, is the common cold, MERS, and SARS. So, looking at the mortality rate when Corona first came out, I was thinking, oh, it seems like it's going to be somewhere in between MERS and the common cold. So I was thinking, oh, it'll be a mild to severe kind of pneumonia. Basically, that's what we can expect. Um, and at the time, I think I underestimated how infectious corona would be and how quickly it would spread. And that's also kind of the reason why I have been reluctant to come out here and do this video, because I think in the time when I said don't worry about it, I was speaking more so to the mortality rate, as in don't worry about it, we have diseases that are more deadly than this. But I think, in a sense, that's the wrong way to kind of speak about this, and I think that's how a lot of people initially were speaking about it. I mean, obviously now we know that's the wrong way to go about it, but I'm just saying for myself, that's where I kind of I felt like I wish I had just said, you know what, I'm not going to comment on this. Let's let the story develop and then I'll comment on it later. So that's why I was saying I'm going to speak to you now as the situation is. The situation can change, and I'm speaking to you as somebody who's knowledgeable about general medicine, but not a specialist in infectious disease and not a specialist in pulmonology. So yeah, I'm gonna try and explain corona as simplistically as possible as I can. Yeah, we'll see how it goes. Cause yeah, I've tried not to use big words. Although really don't think I use big words, but I'll try my best. An inflammatory process of the lungs. It affects both lungs. And what do I mean by inflammatory process? I mean, it's a situation where when you have an inflammation in your body, it's basically your body trying to send a lot of your blood to that area, because the blood carries these immune cells, and the immune cells go to a location of an infection to go and fight the infection. So basically, your lungs kind of like fill up with fluid, and this fluid is more so just because blood is kind of pulling out of the vessels into the lungs, if that makes sense, to essentially fight the infection. So this is where the breathing difficulty comes from, because this part of our lungs, we're talking about more lower respiratory tract, is responsible for oxygenation of blood. So when we breathe in and we get that oxygen, it happens more so here and in the alveoli. So the lower we go, the more this process is kind of involved in our actual breathing. Whereas here, upper respiratory tract, this is more so like a tunnel for air to come in, and this is where we see more of our upper respiratory tract infections and our common colds and coughs, essentially. We do deal with pneumonias routinely in the hospital, and it is actually probably, I'm not sure if it's the number one killer of old people, but in the hospital, normally when an old person is in the hospital, the first thing we're thinking is let's get them fixed, whatever they came in for. If they came in for a hip fracture, if they came in for gastroenteritis, let's get that sorted and get them out, because we don't want them catching a hospital-acquired pneumonia. And hospital-acquired pneumonias are more bacterial and they're more resistant to antibiotics. So those tend to kill the elderly very quickly. And this is a common thing that I've heard when I was here in Poland rotating in my clinical classes and also back home, which is get the older people out ASAP, because we don't want them catching a hospital-acquired pneumonia. So pneumonia is known to kill older people, and this is something that I kind of want to convey as well, because I feel like people don't know this. I believe the most common cause of viral pneumonia is influenza. So influenza, the flu virus. Um, Pneumonias are quite common, but again, I want to say that this is a more severe pneumonia in the sense that people are progressing to more life and death situations. The comorbidities, I guess, that would put you at risk for developing severe pneumonia, and ARDS, so acute respiratory distress syndrome. Basically, the worst case scenarios of coronavirus. Basically, being older, which we've been hearing because it's been such a controversial thing. It's not just older people that die. So when we say older, when I say older, I mean people that are like 50 years and above, people that have comorbidities. So a lot of people have hypertension, and cardiovascular diseases is right up there. So even though we say older, it's really not that older. If we're talking about like my parents, we're talking about your parents. So I think we underestimate it in the sense that when I was talking about pneumonias kill older people in hospitals, I'm talking about like the 70 years old, that's in hospital. I'm not talking about the 50-year-old with a common comorbidity. So that said, um, comorbidities are important, such as hypertension, diabetes, and then you have people who have respiratory disorders. We're talking about people who have asthma. We're talking about people who have COPD. If you're a former smoker, the amount of time from the time you stopped also plays an impact on how much your lungs have this, like managed to recover and regenerate. So even smokers are at risk. People who have maybe genetic respiratory conditions like sarcoidosis or something. So there's a lot of There's a lot of risk factors, and I don't want to limit it to it's just older, because there's a lot that goes into the whole presentation of a person. And I think a lot of people are trying to make it like medicine is a one shoe fits all. It's not the case. Every patient is different, and every patient comes in with a very different profile. Case in point, I was reading the other day a 33-year-old patient deteriorated quickly in the hospital, and everybody wanted to know what's his comorbidities because it didn't make sense. 33 years old, he doesn't have asthma, so what's going on? They look at his BMI. His BMI is 41, and BMI is basically, it measures how obese you are, and he's morbidly obese. We're top of the range. And so things like this, like obesity, it means like your fat is essentially pushing down on your lungs, and your lung muscles cannot work as well. So you have a restrictive lung disease in a sense. So this is why when I say people need to not say things loosely, this is what I'm talking about, because there's a lot of things that play in and that factor into a person's overall health besides just age. So yeah, you could be 60 years old and you don't have a single comorbidity, and you could be better than the 50-year-old who's got hypertension, diabetes, ischemic heart disease. You get what I'm trying to say? So yeah, an important consideration. And all I can say is that I would advise for the older people and for people who know they have pulmonary issues, people who know they are immunocompromised, so people who have like cancers or are on steroid medications, people who have immunodeficiency diseases, people who have like HIV should all be kind of making sure they're doing the most to stay quarantined and away from possible exposure to this disease. So yeah, that's what I would say are the risk factors, extending on what has already been said. How do you treat a viral pneumonia? Because I mentioned that with bacterial pneumonia, you give antibiotics and that helps. Well, a viral infection is basically this pathogen that enters your cells. Bacteria don't, not all of them, some of them do, but the vast majority, I'm talking about like 90% of them, stay outside your body. But viruses come into your cells. So they live within your cells and they make copies of themselves using your own cells. And so that's why viruses are harder to deal with. Some viruses are smarter than others. They mutate. I don't think we're seeing that the coronavirus is really mutating, which is something HIV does, which is something influenza does, the flu does. That's why we always say get your flu shot every year. So yeah, basically the virus, it takes over your machinery. And so that's why when we say sometimes, when the doctor says sometimes, I can't give you, or I'm not going to give you antibiotics, you should kind of wait and see how this goes. It's because sometimes the infection that you have is it's probably viral. And if it's viral, we can't do anything about it in the sense that it has to resolve by itself. We can give you supportive treatment. Supportive treatment is like we'll give you fluids, we'll give you stuff to bring down your fever, because when you have a fever, you also lose a lot of fluids, and that has another implication with the heart and cardiovascular system. So we try to maintain those. We obviously give you painkillers, and yeah, supportive treatment. If you go into a situation where you have severe dysfunction of your lungs, we'll give you oxygen support. But it's pretty much things that we just do to kind of help you along your road to recovery. But we don't really give anything. There's one antiviral that kind of helps speed up influenza, the flu virus. So hopefully Corona will be able to get something similar to that. And obviously the thing we all want the most is a vaccine. But again, vaccine takes longer. So in the meantime, there are clinical studies being done to see what medications, what antiviral medications are out at the moment that possibly help the dry cough. That's one thing that has been stated over and over. But more importantly, I would say fever and myalgia, because that tends to indicate normally that there's a viral infection going on. And then there's also just dyspnea. So dyspnea is the inability to breathe when you're feeling like I can't breathe or out of breath. So how can you help prevent the spread of corona? staying at home. Well, obviously, you cannot stay at home forever because you need to go out there and get food and all of that good stuff. But try and be wise about your comings and goings so that you limit the amount of time you're out exposed to the outside environment, apart from social distancing, quarantine style. Also, social distance yourself when you're out and somebody's coughing. Step away from that person. Like, this is just common sense of how you would normally avoid getting sick. Distance yourself even when you're with people. Yeah, just try not to touch things unnecessarily. Stay away from rails. Things where you can think to say, a lot of people touch this. I probably shouldn't touch it. Try not to touch it, to be honest. And then obviously wash your hands. It cannot be said enough. Sanitizers are out of stock. But sanitize your hands if you got sanitizer. But the best thing is always to wash your hands. If you're obviously not in a place where you can wash your hands, sanitizer is the next best thing. But keep washing your hands. Don't touch your face. I'm hoping these are things you guys already know, but don't touch your eyes, especially your nose and your mouth, because that's your mucous membranes, and that's how your virus really gets in there. And as for the masks the healthcare professionals need it. People are saying they're not useful. They're useful, but they're not useful for the average citizen. People in the healthcare world need it, and they need it for things besides corona as well. They need it for diseases that are a lot worse than corona. For example, we have a TB ward in our country, and all the health professionals need to be wearing the mask all the time, this N95 mask, when they're in the TB ward. So for stocks to be completely out all over the world, it sucks because now these people who are trying to help you are now going in there without any sort of protection. And on top of that, we have people who are immunocompromised, people who have just undergone chemotherapy, and they need it to be protected from everybody that's coming into their rooms. And also, we as doctors need it when we enter their room so that we're not giving them any sort of infections that we might be carrying that is, not affecting us because we have intact immune systems, but that would affect them because they're so immunocompromised. So, yeah, guys, unless you yourself are immunocompromised, unless you yourself are sick, I would say don't hoard. If you have something, buy enough, but just don't hoard, especially not masks. Like, I think I can get over people hoarding the sanitizers, but the masks is just like, please, guys, because I'm hearing hospitals don't have enough of this, and this for me is like, it's really sad. I will say initially when Corona broke out, I feel like people were trying to quarantine people to essentially stop the disease. Um, when I say stop the disease, I mean like I feel like they were quarantining people hoping that it would just go away. Those people would recover and the disease will completely disappear away until it like reappears in a couple of years or something. Essentially how Ebola is. But here's the thing, now that it's spread all over, quarantine efforts are not to try and make this thing disappear. It's basically to try and control how it's coming into the society. So when we say how it's coming into the society, we want it to come in little peaks, little peaks, little peaks, little peaks. So that way, healthcare workers can, treat people. If you're coming in with a big peak of people and you're coming in with 100 versus 10 people at a time, it's harder for a doctor, a nurse, anybody in the healthcare profession to really give you the best quality healthcare because there's not enough resources, there is not enough staff to treat you. So we want to flatten the peak, as they say, or flatten the curve. And that's just the idea that we want to make it a steady stream of corona cases where we can manage them without becoming overwhelmed and without losing unnecessary lives because we didn't have a ventilator machine or we didn't have a spare ICU room. We need to understand that quarantining is not just, oh, I'm quarantining myself when I feel sick. It means I'm quarantining myself before so that I don't catch it and pass it on to other people that are around me. Whether you live alone or you don't, it's easy to pass this thing on. So the best thing you can do is just really try to stay indoors. And moreover, I feel like if you're living with older people, it's very important that you take into consideration where you go, what you do. And yeah, I think it's up to us as a society to kind of play our part in this. And it's easy to say, oh, I haven't had any flu-like symptoms, but basically, people's bodies are different. So somebody might underestimate and say, oh, I didn't have corona, I just had a few sniffles. Like, no, that wasn't me. But you might be unknowingly a carrier of corona and you might be transmitting it to people. So it's just one of those things of better safe than sorry, stay at home. I was going to show you guys this, which is WHO WhatsApp number. It's +4179893189 That's 4179893189. You can WhatsApp message this number and just send them a message saying hi, and you can get a lot of information from them. They will tell you about the latest numbers, how to protect yourself, any questions you want answered, mythbusters, travel advice, news and press, as well as how to donate. So yeah, do yourself a favor and just check that out, because I think it's important to stay informed, but also to stay informed by the right sources so that you're not just taking in everything. Which leads me to my next point. Um, I wanted to kind of also mention some few positives, make things a little bit nice and happy, because we can't always just be like depressed and sad and fear ridden and, like losing our minds and not seeing the light at the end of the tunnel. So one of the things that I am happy to hear is that it does not really affect children. It's which is unusual for pneumonias, because pneumonias tend to affect children. Kids get a lot of pneumonia, so I am in that sense glad. That's one pro. The other thing that I wanted to say is that we're lucky in the sense that we're dealing with a disease that 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 we know how to manage. We know how to manage pneumonias, and so it's not a situation of something we've completely unseen or unknown to us in its presentation. So in that sense, we've been kind of given a little bit of, you know, leeway in that sense. The other thing is that death mortalities are varying between countries. We've got people with 0.1%. I think instead of us saying, oh, this is what this country's done wrong and this is what this country has not done enough of, why don't we look at the countries that do have really, really good statistics and find out what they do at a public level, what they do at a health level to not only maintain um, the virus, so contain it in terms of numbers, but also in terms of treating their people, what are they doing? So I think in that sense, and as time goes on, we will have more information. And that's the thing that I really want to also stress, is that this isn't the first time we're having a new virus coming into society. It isn't the first time we're having an infectious disease outbreak where we've never seen the disease before. But this is the first time when we are a lot more knowledgeable. A lot of the diseases and viruses that have presented for the first time have been in the past when people didn't know a lot about, health. They didn't know a lot about medicine, and so in that sense, we're in an advantageous position because we are a lot more advanced. And yeah, I think that's one thing that should give us also kind of hope for the future. Globalization allows us to real time share information. This is the advantage of our present time. And so I just want to kind of finish off on a lighter note and say that we will get past this, but it is also a situation where for the first time we are being challenged as individuals to take responsibility and help stop the spread of this disease. This is a weird disease in the sense that it requires accountability by individuals. And so in saying that, this isn't the worst disease, but it can be the worst disease if we are not united and if we're not serious and we are not caring about, protecting our essential community against this. So it's up to everybody to kind of play their roles and the sooner we can also get on one page and make sure we're, you know, doing our parts, the sooner we can get past Corona and get back to our lives. I know everybody's anxious to get back to life and all of this stuff, but I just feel like this is a time where everybody needs to kind of keep a cool, calm, collected head and do what they need to do and do their part. I just wanted to kind of give a little bit of hope because I feel like everything that's on TV at the moment is just negative, negative, negative. And yeah, that's all I really wanted to say. So I leave you with that, and I trust in you guys, and I hope you're all doing your part because somebody's life depends on it.